Good morning. Many of you know me, and for those of you who don't, my name is John Holland, and I am one of the nurse case managers here on the Oncology Hematology Unit at McLeod Regional Hospital. I have 8 years of experience working as a registered nurse on a variety of medical and surgical units, as well as here on our own oncology unit, before becoming a nurse case manager. My purpose today is to discuss with all of you the roles of the case management team in coordinating patient care at our facility, the role of the floor nurses in care coordination services, and various policies that affect the delivery of care in today's hospitals, including our own. I sincerely hope you will all walk away with a new sense of awareness about the importance of nurses in providing care coordination to improve outcomes and quality of life for our patients. I would like to start by remarking on the unique patient population we have here on the oncology unit. We are primarily treating patients with a wide variety of oncologic and hematologic conditions, and we also have a special relationship with the palliative medicine team, regularly providing end-of-life care for hospice patients. Our hospital is geographically located in an agricultural region where historic pesticide and fertilizer use has led to an alarmingly high level of cancers in our immediate community. We also have 14 nursing homes within a 10-mile radius of our hospital, and our floor is commonly utilized by the family medicine department as a transitional unit for nursing care patients recently downgraded from progressive care units awaiting transfer back to long-term care facilities. We also receive overflow from medical, surgical, orthopedic, neurology, renal, and cardiology, depending on the census. In acute care settings, care coordination is a complex process due to the emergent condition of our patients. Nurse case managers act as coordinators of patient care, ensuring that the necessary information and structures and activities are in place, leading to a continuous delivery of care to our patients across healthcare settings, including referrals to specialists. As patients move within and across healthcare settings, there is an increased potential for medical errors and discrepancies in care because of poor communication and the involvement of new care providers unfamiliar with patient history and treatment plan. Case managers utilize the nursing process to assess and evaluate patient needs, incorporate comprehensive care planning, ensure care plans are implemented across healthcare settings, and measure the effectiveness of these efforts on patient outcomes. Care coordination efforts begin the moment patients are admitted to our facility. Floor nurses have a significant role in these efforts through routine duties including admission assessments, medication reconciliation processes, and evidence-based risk assessments to recognize and identify patient needs that will lead to safe, efficient, and thorough care delivery at our facility. As you all know, many of our patients have complex healthcare needs and require intensive coordination of medical services involving multiple providers. Floor nurses and case management work together to ensure that specialist consults are being placed as needed, as well as following through that specialists have received the consult and are examining our patients. Together, we are establishing coordinated care services that will connect patients with required specialists and services. Many of our patients will continue to follow these specialists in the outpatient setting, which is particularly true with our McLeod Oncology and Radiation Oncology services. Because hospital stays are short-term in nature, our care coordination efforts focus on specific care planning with a goal of stabilizing our patients and providing a safe and effective transition to outpatient care while maintaining care continuity through appropriate referrals to primary care providers and specialists. The Agency for Healthcare Research and Quality has identified primary care as the model for providing comprehensive patient-centered care. In light of this recommendation, we must all be aware of the fact that many of our patients find it extremely difficult to navigate today's healthcare system. Patients and their families are often experiencing extreme burdens when trying to find and access appropriate primary care and specialty services in the outpatient setting. Without access to primary care or health insurance, many patients utilize the hospital and emergency department for treatment of chronic condition exacerbations that could have been prevented through regular primary care and screening. Our nursing code of ethics and values guides and supports nurses to treat all patients equally with dignity and respect. Patients admitted to the hospital without health insurance coverage are provided with social workers who can link patients to government-sponsored and subsidized insurance programs, including Medicare, Medicaid, and the health insurance marketplace through the Affordable Care Act. Patient-centered care is providing health care through patient and/or family relationships, with a focus on acknowledging and respecting patient needs, preferences, and values. Assessing patient needs is an ongoing part of each nurse's daily routine, and assessments and extends into case management services through comprehensive need assessments, rounding responsibilities, and establishing comprehensive care plans for each patient during their hospital stay. Providing patient-centered care involves patients maintaining independence in care delivery and feeling they are partners with care providers. Patients must be included in making decisions about care choices in order to establish engagement and trust with providers. Nurses routinely practice patient and family-centered care through assessment of patient needs, establishment of plans of care. Floor nurses manage patient care 24 hours a day and are routinely involved in care coordination responsibilities through regular nursing care activities. I would like to discuss a few examples of how nurses engage with patients and their families to provide patient-centered care. The medication reconciliation process is an important point to invite patient and family participation. Patients who are involved in their care or their family members can provide an up-to-date medication history that will lead to safe and efficient prescribing and administration. Nurse responsibilities include educating patients on new medications, potential side effects, and interaction with other medications. Nurses must ensure patients not only understand what their new medications are used for, but educate them on dosage, frequency, route of administration, and monitoring parameters such as blood pressure and blood sugar levels. Nurses also assess patients' ability, willingness, and readiness to learn, as well as the patient's preferred learning style, such as explanation, printed materials, and/or demonstration. At discharge, nurses significantly contribute to care continuity processes by educating patients and family members about new medication regimens, side effects, and administration parameters, as well as ensuring plans of care, including follow-up appointments and significant nursing care responsibilities being taken over by the patient or family, such as wound or stoma care, dressing changes, having the necessary durable medical equipment, oxygen, CPAP, and other medical supplies are being taken care of. Nurses can also make recommendations to providers for outpatient services, including diabetic educators, home health nursing, and physical therapy, to name a few. By reducing gaps in coordination of care services, delays in patient treatment can be reduced, thereby decreasing the rate of complications that may lead to patient harm. In other words, nursing activities that focus on patient-centered care lead to improvements in patient outcomes through comprehensive care coordination. This will also lead to a reduction in unnecessary hospitalizations. Another key area where nurses and case managers can provide patient and family-centered care with a focus on cultural competency is the establishing of goals of care for the frail elderly patients and the medically complex patients with life-limiting conditions. Through performing comprehensive needs assessments, nurses can discover individual and family wishes with regards to end-of-life care. This is a delicate but necessary topic, especially on this floor, where many of our patients have life-limiting conditions for which there are no treatment options other than palliative care. It is our shared responsibility to assess these needs and utilize effective and therapeutic communication to relay this message to providers for palliative care referrals, as well as spiritual care visitations and appropriate changes to code status. Patient-centered care is about providing excellent care, encompassing the physical, emotional, and informational needs of the patient, and aligning care with patient expectations and preferences. Patient-centered care is strongly tied to patient satisfaction, a commonly measured metric that has led to significant transformations in healthcare delivery. Patient satisfaction in acute care hospitals is measured through a patient survey known as the HCAHPS, stands for Hospital Consumer Assessment of Healthcare Providers and Systems. HCAHPS measure patient perceptions in their care experience, otherwise known as patient satisfaction. The data gathered from the HCAHPS scores are used to improve healthcare delivery by influencing quality assessment and improvement initiatives. HCAHPS ratings directly relate to reimbursement to hospitals by the Centers for Medicare and Medicaid Services. This value-based payment system, reimburses hospitals based partially on the patient perceptions of their hospital care, meaning lower HCAHPS scores can cost the hospitals tens of millions of dollars annually. The changes in healthcare delivery systems from the traditional functional-based hospital to the patient-centered approach asserts that care designed to meet the individual patient's needs will result in more effective treatment, as well as improve hospital efficiency through reducing waste and redundancy. One aspect of care coordination that I want to clarify under this topic of value-based payment systems and cost containment strategies being put forth through the Centers for Medicare and Medicaid Services and the Affordable Care Act is that care coordination does not exist simply to save hospitals money through rationing of care. Care coordination exists because it provides better patient care. While to some it may seem that the case managers are always pushing to get patients discharged, the fact is our role is to transition the care of stable patients to home or more appropriate lower levels of care, such as rehabilitation or long-term care facilities. Prolonged hospital stays are inappropriate for a variety of reasons, from inefficient use of acute care resources to increased potential for nosocomial infections and other hospital-acquired conditions. The final area I would like to discuss is how patient-centered care model has impacted hospital and nursing roles. Firstly, hospital units are becoming multi-specialty units rather than specialty-specific in order to deliver care that is more appropriate for the patient. This phenomenon is playing out on our floor every single day. While our focus is oncology and hematology, we care for general acute level of care patients from a variety of disciplines with emphasis on palliative care and nursing home patients awaiting transfer back to nursing homes after being downgraded from progressive care units. This combination of responsibilities translates into our floor operating as a high-functioning progressive care floor, regularly dispensing and administering chemotherapy and blood products, complex PCAs, surgical and post-operative patients, heparin drips, telemetry monitoring, and extensive wound care as part of our normal daily routines. The second area is patient-centered care has become more integrated with multiple specialists collaborating to provide holistic care experience, including nurse specialists such as nurse practitioners, diabetic educators, and hospice nurses. To ensure care continuity across healthcare settings, nurses are increasingly responsible for ensuring these specialist consults are being made and the consulted specialists are actively involved in our patients' care. The third area is patient-centered care calls for new and efficient managerial roles, i.e. the role of the case manager, who has the responsibility for effectively and appropriately integrating patient care delivery and care transition across healthcare systems to maintain continuity of care that will ensure improved patient outcomes and quality of life. In conclusion, it is my sincere hope that this presentation will reinforce the idea that our roles as nurses and as case managers overlap with many shared responsibilities, with our primary goal in providing our patients with excellent, high-quality care. Thank you very much.